I organized St. Michael's as a facility of ours in 1980 when I was a child.
Well, on a personal level, I was actually born in St. Michael's Hospital.
This hospital is a community hospital for the people, and it's for the community.
I've been with the union the entire time, and St. Michael's is one of my special places.
No patient is turned down here, regardless to what your income is or your background.
I've been here 17 years, and there's people who've been here way longer than me. So we're really a family.
Traditionally, over the last several years, probably the better part of the 20 years, St. Michael's has been losing money, and there was an opportunity for St. Michael's to close.
First alarm was contact from the potential buyer.
At the time, I found out that there was a company that was trying to purchase St. Michael's and was meeting great opposition, all for the wrong reasons.
They didn't want it to become a for-profit hospital.
Everyone was very anxious, not pretty anxious. Everyone was very anxious.
Basically, from what I was hearing, they were closing St. Michael's. Then there was a rumor they were going to consolidate St. Michael's, but eventually close it. And we'd only have one choice of a hospital to go to.
When the community was made aware that St. Michael's may possibly be closing, they were devastated. But then they were also angry.
No one has the right to tell me or anybody else, you can only go to that hospital, especially since those other facilities didn't treat me like I was a human being.
The community needs this facility. They're doing all this building around here. Where are these people gonna go?
It was like, are we gonna have a job or not? Should I be going other places?
The concern was, what were the unions gonna do about it?
We knew we had to gear up and do something and do it correctly.
We immediately got together to devise a strategy to ensure that St. Michael's would continue to exist.
I immediately took my organizing skills and organized all the patients in the bariatric center, all the patients in the family health care clinic downstairs where I've been treated numerous of times.
We held rallies, we held marches from St. Michael's to City Hall.
Getting to all the members, making rounds in the hospital, making sure that the people that were here stayed here.
Our union members that are here have been dedicated employees here for a long time. They've committed themselves to this hospital.
Every time the commissioners from the state of New Jersey Board of Commissions for Public Health came to hear about St. Michael's, our population grew, and it grew, and it grew.
We gathered over 50,000 signatures on petitions. We drove them down to Trenton. We held a press conference at the State House, and then our leadership, along with some elected officials, delivered them directly to the governor.
I mean, it was a whole group of us, and we were so happy and so excited to be down in Trenton, to actually place on the desk down there in somebody's hand and say, this is what we've collected to save St. Michael's.
Saving St. Michael's did become a community effort.
People were more interested in what they could do, where they had to be, who they had to give, were there petitions.
Whatever meeting they needed us to go to, whatever petition we need to sign, we did the work for it, and we put our heart into it.
We were thrilled. Everybody was very happy. Of course, it's a big celebration.
A good reason that St. Michael's is still here is because our members stepped up in a big way.
There's over 1,400 jobs here. These are the people that cared for me when I had nothing. So I just could not allow the hospital just to close and not have the services that I was entitled to.
They weren't willing to walk away, and in all good conscience, we could not walk away. And it was for the passion that they have that the residents of the city of Newark are better served, because the residents of the city of Newark also said, we deserve choice, and we deserve quality health care.